Hey everyone, let's talk about treatment today. This is one of my favorite topics because there are so many great treatment options for psoriasis now. Hi, I'm Dr. Jennifer Soung. I'm a board-certified dermatologist and clinical researcher. I specialize in medical dermatology. What that means is I treat patients with serious skin conditions. Today I'm going to give you an overview of all the different treatment options for psoriasis. What you and your doctor choose together depends on several factors. One is the location of the psoriasis. The topical treatments that we give for your scalp are going to be very different from the ones for the arms and legs. The severity, so how thick, scaly, painful, and itchy the psoriasis is. And most importantly, how it affects your life. For many patients, it's a very visible disease that affects multiple aspects of their life, including what they choose to wear when they first wake up in the morning, to getting a job, and even their relationships. Another factor that's important when deciding on your treatment is whether you have arthritis connected with your psoriasis. Did you know that the inflammation of the skin can affect the joints and cause damage to the joints in about 30% of patients? This is called psoriatic arthritis. It's important for your doctor to know if you have arthritis because there are certain treatments that will target the inflammation of the skin and joints at the same time. Okay, let's get started with our overview. I'm going to present them in large categories. The order in which I present it does not mean this is the order in which you have to try it. One option is topicals. These are medicines that are applied directly to the skin. They come in various creams, ointments, clear solutions, gels, and even oils. It's really important that you find one that you like how it feels on your skin. Most of them are topical steroids, and they work by decreasing inflammation at the skin. Most of the time, these are convenient, can work quickly, and be safe in the short term. But for a chronic disease like psoriasis, long-term use of topical steroids can result in damage to the skin, like excessive thinning or easy bruising. Another option is light therapy, also called phototherapy. This type of treatment uses a specific component of natural sunlight called UVB to decrease inflammation in the skin. So what it's like is you undress and step into a light box, and the ultraviolet light treats your entire body to decrease inflammation in the skin at the same time. So imagine it's something like an indoor tanning bed, but indoor tanning beds are not a substitute for light therapy. Indoor tanning beds increase your risk of skin cancer. So overall, about 50% of patients can see a good response to light therapy. It usually takes about 4 weeks to see a response, and it does require you to go to the doctor's office on a regular basis for 2 to 3 times a week for about 3 months to get clear skin. So what's next? In situations where the topical is just not working and the light therapy is not possible for you to come to the doctor's office on a regular basis, or maybe you have multiple areas of skin that are affected by psoriasis, making it hard to apply that topical every day and everywhere, systemic medications are best. These are medications that work throughout the body. These target the inflammation of psoriasis by working from the inside. So these medicines are taken by mouth as a pill or given by injection into the skin. Let's start with the pills. There are 3 main options. One is methotrexate, Otezla, and then cyclosporin. So methotrexate is actually a chemotherapy medicine. I know, that sounds really scary, using a chemotherapy medicine for a skin condition. In fact, we've used it for over 50 years in dermatology to treat multiple skin conditions and not just psoriasis. We use it at very low doses to control inflammation in psoriasis. You take it only once a week. At the beginning, you'll have frequent and regular blood monitoring, watching for the liver and blood counts. It's also a medicine that works in about 40 to 50% of patients, and these patients can get clear skin. In some patients, Side effects include nausea and a feeling of tiredness. It is a medicine that we doctors watch very carefully for liver side effects, especially if you've been taking it for several years. Another pill option is Otezla. This medicine works by targeting a specific protein that controls inflammation in psoriasis. It's taken twice a day. One of its advantages is it doesn't require routine blood monitoring, but I do recommend that all of my patients have a recent routine health exam with their family or regular doctor because improving your overall health will also help your skin heal. So in general, Otezla takes about 4 weeks to start to see a difference and then 4 full months to see the full response. Overall, about 30% of patients can get clear skin. And about 25% of patients can get nausea and diarrhea. It usually happens within the first 2 weeks and then starts to go away as your body gets used to the medicine by the end of the first month. If this happens to you, there are many ways that we can help you feel better before the medicine starts to work to clear your skin. And then the other option is cyclosporin. This is what I call my rescue medicine because it works in over 90% of patients and it works quickly. It's very useful in the situations where the psoriasis is very widespread or severe. It was originally invented for organ transplant patients to prevent their immune systems from rejecting their organ. For skin conditions, we use it for up to a maximum of 1 year because in transplant patients, they've shown us that taking it for many years can lead to multiple skin cancers and even rare types of blood cancers. It is a medicine that has a very small risk for kidney damage, so we will be monitoring your kidneys regularly during your treatment course. It's also a medicine that can raise your blood pressure, so we'll also be checking your blood pressure. And finally, biologics. These are medications that are given by injection into the skin. Remember how I talked about how the inflammation of psoriasis inside the body can be so much that topical medicines and light therapy are not enough to help your skin heal? Biologics work by lowering that inflammation from inside the body so that your skin can heal on the outside. What's a biologic? It's a protein that's made from living cells that target key inflammatory proteins that are elevated in the skin and blood of psoriasis patients. These medicines are given by injection into the skin because if it was taken by mouth as a pill, the acids in your stomach would simply digest the proteins, kind of like the protein that you eat in your daily meal. There are many different choices for biologics now. What you and your doctor choose depends on several factors, including your current health status and your other medical conditions. The 3 large categories of biologics are grouped based on the specific inflammatory protein that they lower. So 1 is TNF, 2, IL-12 and or 23, and then 3, IL-17. These are the names of the key inflammatory proteins involved in psoriasis inflammation. In general, these medicines can have a risk of infection. Most of the time, it's just a common cold. Other risks include pain and redness at the injection site. There are also some other not so common side effects that your doctor will talk to you about and monitor for during your treatment. In general, these medicines have changed the lives of psoriasis patients because patients now can get clear skin, stay clear in a much safer way. That's an overview of psoriasis treatment for today. Find a doctor that knows psoriasis and can help you find the right treatment.